After 70, real health comes from choosing carefully, not collecting checkups like souvenirs. Modern medicine is powerful, but power without precision can drain energy, money, and peace. This narration reveals 5 overused tests that quietly create fear, false alarms, and procedures that fail to improve life. The goal is simple: protect independence, avoid cascades, and focus on changes that actually help. 2 open loops keep attention to the end. The second item is assumed mandatory by many, and the first is sold as prevention while creating new risks. Before any test, use one question that cuts through noise. If the result is positive or negative, what meaningful action truly changes? If the next step is unclear, the test may be a trap disguised as safety. Engage with the story as a partner in your own care. Comment with age group, city, and one test that led to worry or extra appointments without improving how you felt. Also share the habit that made the biggest difference, like resistance bands 3 times a week, daily walks with a friend, better hydration, or a steady bedtime routine. These humble levers beat most checkups at delivering real benefits after 70. Like and subscribe to keep practical scripts coming weekly. The transition is clear now. Common tests look harmless because they are familiar, fast, or marketed as essential. In older adults, however, normal aging changes can mimic disease on images and numbers, turning reassurance into a cascade of follow-ups. Start with bone density scans in low-risk adults. The DEXA machine turns bone health into a single score that often drops with age even without true danger. Mild osteopenia becomes a doorway to long medication courses with modest fracture benefit and real downsides such as reflux, esophageal irritation, rare jaw complications, and atypical fractures. For seniors who have not fallen or broken a bone, the smarter path begins with strength and balance. Train legs and hips, practice single leg stands near support, add protein at each meal, and prefer calcium from food like sardines and leafy greens. If vitamin D is low, replace thoughtfully. For recent fragility fractures or high-risk profiles, targeted treatment remains appropriate and should be guided, not assumed. Move to brain MRI for mild forgetfulness. Occasional name slips and misplaced keys are common in healthy aging and often reflect sleep debt, dehydration, mood, hearing strain, or medicines that block acetylcholine. A structural MRI is excellent for red flag neurology, such as new weakness, seizures, or rapid change, but it is a poor tool for reassurance. White matter spots and mild shrinkage are routine in older brains and can be misread as disease, triggering repeat scans, spinal taps, and even biopsies without improving memory. Begin instead with a brief cognitive screen, medication review, hydration, sleep tuning, and hearing and vision checks. Add daily learning tasks that stretch attention and recall. Image only when symptoms point sharply to a structural cause. Cardiac stress testing without classic symptoms is next. The test shines when chest pain on exertion or breathlessness suggests coronary disease. Used for vague fatigue, it generates false positives that launch angiograms and stents, which, outside of heart attacks or high-risk anatomy, rarely extend life or relieve symptoms. Contrast dyes can stress kidneys, and procedures can bleed or slow recovery. Start smarter with careful history, a resting rhythm strip, labs for anemia and thyroid, and fitness-matched walking assessments. If imaging truly adds clarity, consider coronary calcium scoring as a low-dose snapshot that guides prevention rather than reflex procedures. For active walkers without exertional chest pressure, training and hydration often outperform machinery. Colonoscopy after the mid-70s deserves nuance. Screening saves lives earlier, yet benefit falls as risks climb with age. PrEP can dehydrate and destabilize electrolytes, sedation can cloud cognition, and mechanical injury can cause bleeding or perforation. Many late-life polyps are small and slow-growing, and removing them can harm more than help when overall risk is low and prior colonoscopies were clear. Match intensity to realistic benefit by weighing symptom status, family history, prior results, and overall health. For those who still want screening in good condition, a stool-based test at home can act as a safe gatekeeper that flags only those who truly need scoping. Symptoms like bleeding or persistent change always deserve attention. Whole-body CT scans marketed as executive prevention are the climax of this list. They promise early detection but deliver high radiation, incidental nodules, and chains of follow-ups that end in biopsies and surgeries with real complication rates. Without symptoms indicating where to look, positive predictive value collapses and anxiety grows. Leading radiology groups advise against whole-body screening in healthy adults. A wiser approach is targeted imaging when a specific story demands it, such as unexplained weight loss, coughing blood, new focal pain, or abnormal labs. True prevention for seniors is blood pressure control, glucose management, vaccinations, fall-proofing, muscle preservation, mobility, and restorative sleep, not treasure hunts through healthy tissue. Understand the cascade effect so you can stop it early. A vague test result breeds more tests, then consultations, then interventions, each step gaining momentum because no one wants to be the person who stops the process. The antidote is a simple decision chain prepared in advance. Write the next step for a positive result and the next step for a negative result before taking the test. If both paths lead back to watchful waiting and lifestyle, skip the test and start the plan now. This prevents anxiety spirals and protects time and energy for routines that deliver measurable gains in strength, balance, mood, and sleep. Build a home that prevents falls, because preventing one fall beats chasing 10 scan results. Light hallways and bathrooms, mount grab bars, raise low lamps, remove loose rugs, secure cords, and choose supportive shoes with good traction. Store heavy items at waist height, keep a nightlight path to the bathroom, and use a non-slip mat in the shower. Practice sit to stands from a firm chair, heel raises at a counter, and tandem stance along a hallway wall. 10 minutes daily builds the reflexes that stop slips from becoming fractures, and fractures are the fastest route to lost independence. Design a weekly movement plan that respects recovery while stimulating growth. 2 to 3 sessions of resistance training cover legs, hips, back, and grip with slow, controlled tempo. Balance work threads into small moments, like standing on one leg while brushing teeth or walking a straight line heel to toe. Add brisk walks on most days, climbing gentle hills or stairs to train heart and lungs without provoking joint flare-ups. Finish sessions with relaxed breathing to downshift stress. Consistency beats intensity, and steady practice reshapes bones, muscles, and confidence after 70. Treat protein as daily medicine for muscles and bones. Aim to include a quality source at every meal, whether eggs, yogurt, cottage cheese, legumes, tofu, fish, poultry, or lean meats according to your preferences. Pair protein with colorful plants and fiber to support gut health and steady glucose. Hydrate earlier in the day to aid workouts and cognition, and add a small salty snack if lightheaded during standing exercises. Calcium from food is well tolerated for many. Add vitamin D only if levels are low. Nutrition works silently but steadily, and the payoff appears as easier stairs, steadier turns, and better sleep. Audit medications with fresh eyes twice a year. List everything, including over-the-counter pills, sleep aids, and supplements, then ask which still provide clear benefits. Flag drugs with anticholinergic effects that fog memory, and consider deprescribing under guidance when risks exceed rewards. Align doses with routines you already follow, like breakfast and evening wind down. Carry an updated one-page list to every appointment and keep a digital copy for family. Medication clarity reduces falls, confusion, and emergency visits more reliably than most screenings. Prioritize sleep as the force multiplier for memory, mood, and balance. Create a wind-down window with dim light, gentle stretches, and screens off, and aim for a consistent bedtime and wake time. Expose eyes to daylight in the morning to anchor circadian rhythms and take late caffeine off the menu. If pain wakes you, adjust pillows to support joints and discuss targeted relief instead of defaulting to sedatives. Short naps can refresh, but long, late naps steal night sleep. Better sleep sharpens thinking and halves the urge to chase reassuring tests. Calibrate expectations for reassurance. Humans crave certainty, and tests feel like certainty because they print numbers and images. Yet certainty in medicine comes from matching a test to a specific story, not from testing broadly. Adopt a simple pledge before scheduling anything elective. No test without a next action that clearly improves life if positive, and no test whose negative result changes nothing. This pledge turns you into an active decision maker and gently pressures clinicians to be precise and transparent. Use walking performance as a daily health meter that outpredicts many scans. Time a comfortable pace over a fixed distance, track steps and hill tolerance, and note how quickly breathing settles after a climb. These measures mirror heart, lung, muscle, and balance capacity together, and they improve rapidly when training is consistent. If shortness of breath or chest pressure appears at low effort, that is a symptom that deserves targeted evaluation. Let function lead and tests follow, not the other way around. Reframe prevention to include vaccinations, hearing and vision care, oral health and social connection. Hearing aids reduce cognitive load and fall risk, vision updates prevent missteps, and dental care lowers inflammation that can nudge heart and brain trouble. Purposeful social time multiplies adherence to movement and nutrition habits. Build tiny rituals, weekly calls, neighbor walks, community classes, or faith gatherings. Prevention is a web, not a single appointment, and each strand supports the others. Create a one-page health plan that travels with you. At the top, write goals that matter, like playing with grandkids without knee pain, carrying groceries up the steps, or returning to gardening. List weekly movement targets, preferred protein sources, bedtime routine, medication schedule, and red flag symptoms that truly justify rapid imaging. Bring this page to visits and ask clinicians to mark which tests will change the plan. If a test will not change the plan, consider skipping it and investing that hour into training or meal prep. Equip yourself with conversation phrases that keep care on track. Try these lines. What specific condition is this test looking for? How accurate is it in people my age? What are the most common false positives? And what is the exact next step for positive and negative results? Ask about lower risk alternatives, home-based options, and the choice to revisit in 90 days after a training block. Clinicians appreciate clarity, and precise questions lead to precise care. Now summarize the 5 traps and their replacements. Bone density scanning in low-risk seniors yields labels more than solutions. Replace with strength, balance, protein, and vitamin D only when low. Brain MRI for mild forgetfulness shows normal aging changes. Start with screening, sleep, hydration, hearing, and vision. Stress tests without classic symptoms create false alarms. Begin with history, rhythm, labs, and walking assessment, then calcium scoring if needed. Colonoscopy after the mid-70s needs strict selection. Use stool tests or symptom-led evaluation. Whole-body CT for prevention is marketing, not medicine. Image only when a story demands it. Finish with action and engagement. In the comments, post age bracket, main health goal for the next 90 days, and one test you now plan to question before repeating. Share the habit you will install this week, like chair stands, balance drills, protein-rich breakfasts, or a fixed bedtime with a calm wind down. Ask questions about switching from screening to symptom-led testing, or how to read a calcium score. Like, subscribe, and send this to a friend facing a maze of appointments. Choose tests that change outcomes, drop the ones that only change anxiety, and invest daily in strength, balance, and sleep.